Blood pressure assessment, Jessica Lita, 4330. Patient should refrain from smoking cigarettes or ingesting caffeine for at least 30 minutes prior to the measurement. Patients should be seated quietly for at least 5 minutes prior to taking their blood pressure. Their feet should be flat on the floor without being crossed, back supported by their chair. Their left arm should be placed at heart level. The next thing I will be showing you is a blood pressure cuff, which is what you wrap around the patient's arm. The appropriate cuff size should be used to ensure proper measurement is taken. To ensure that cuff size is correct, there are markers inside of the cuff to show if a larger or smaller cuff size is needed. The bladder within the cuff should encircle at least 80% of the arm. This is the inflation bulb or pump that pumps air into the cuff when you squeeze it. The calibrated manometer gauge shows how much air pressure is inside the cuff in millimeters of mercury. There is a line outside of the cuff which should be aligned with the patient's brachial artery. The cuff should be firmly wrapped around the patient's upper arm. Make sure it is placed on bare skin. You should be able to place 2 fingers inside of the cuff. If this is impossible, you may receive an inaccurate reading. This is a stethoscope. The 2 earpieces at the top are called prongs, and the thing at the bottom is called the diaphragm. This is what you use to hear the sounds, which I will explain in a bit. When you place the prongs in your ears, make sure that they are facing forward, and make sure that it's working by giving it a few small taps. You should be able to hear a tapping sound through the earpieces. Before pumping air, make sure to turn the valve all the way to the right, but not to the point where it's too tight. To release air, you slowly turn the valve to the left. The stethoscope diaphragm should be placed below the space over the brachial artery. The cuff should be quickly inflated by squeezing the pump to around 220 millimeters of mercury if you do not know the patient's blood pressure. Pressure should be released slowly to about 2 to 5 millimeters of mercury per second. Carotid cuff sounds are blood flow sounds observed while taking blood pressure. You should be listening for a thump noise. This is the systolic blood pressure. The diastolic blood pressure is the disappearance of the carotid cuff sound. You must wait 5 minutes before taking the second blood pressure measurement. There are 3 blood pressure classifications: normal, prehypertension, stage 1 hypertension, and stage 2 hypertension.